when we look at data sources like the SEER data source, it's not necessarily so granular that we can always distinguish whether the population is Black, Hispanic, Black, non-Hispanic. But really where I've seen the increased risk is whenever there's population-based studies and they describe the population, at least in the US, as Black. I will admit I don't know the details, as to further subdivision amongst the category of Black and whether or not it's appropriate to use BIPOC in this setting. With respect to why do Black Americans have higher risk of plasma cell disorders than white Americans? I think that's still a question that we can't completely answer. There are a lot of really good research teams in this country and really worldwide that are trying to understand the different genetic-based risks. And it's clear based on some studies that there's some differential with respect to, for example, what the frequency is of particular genetic abnormalities that happen in the plasma cells as they go from normal to abnormal. So one example that I've seen is higher frequency of translocation 1114 in patients who are Black compared to patients who are white. But ultimately, I don't think there's an easily understood answer to that very complex question right now with respect to why the risk is 2- to 3-fold higher in Black individuals compared to white individuals. And then that's a little bit of a separate, it's related, but in some ways then that's a somewhat separate from the issue of when Black individuals actually get diagnosed with myeloma, whether that's at a more advanced state of the disease than in white people. That I think is a little bit more dependent on access to care as well as knowledge of the disease. I would say that in general, myeloma is not a cancer that most Americans are actually that familiar with, and that's regardless of white, Black, or race, ethnicity. It's still a relatively rare cancer, and most people have never heard of it and don't know other people who've had it. But I think what is key in the Black community is to really increase awareness of not only myeloma, but the precursor condition, MGUS, just like there's been enormous efforts to increase awareness of the risks of high blood pressure and diabetes and how that can affect health later on. There's also, I think, sometimes a decreased frequency of access to primary care. Sometimes myeloma is picked up just because of routine blood work, and that can be done sometimes on an annual basis by a primary care provider. And if individuals aren't getting their annual physical and annual labs drawn, then by the time myeloma presents itself, sometimes it's at the point where it's presenting because bad things have happened, like bones are breaking, or patients are very anemic, or there's serious infections, et cetera, as opposed to being found at a more asymptomatic stage when abnormalities such as high protein levels in the blood are noted, but patients are otherwise feeling well. So I think you raise some really excellent questions, and I think there's a lot of room for improvement in this country for not only improving the research so that we understand what the genetic bases are for developing plasma cell disorders, but also increasing education throughout this country, but specifically in the Black population, and then making sure that everybody has access to care.